Hello, my name is Anna Bucio, and my research question was the following. In pregnant women with an incompetent cervix, does the placement of a cervical cerclage compared to treating with expectant care being modified or strict bed rest lower their risk of premature delivery before the third trimester? I chose to research this topic because I have personally suffered from preterm delivery. My soon-to-be 11-year-old daughter was born at 26 weeks and was admitted into the neonatal intensive care unit where she spent her first few months of life. I am currently expecting my second child, and with this pregnancy, I was diagnosed with an incompetent cervix due to painless cervical dilation and a shortening cervical length of 0.9 millimeters at 25 weeks. At 26 weeks of gestation, I received a rescue cervical cerclage and have managed to stay pregnant. I'll be 35 weeks next Monday. As we know, the cervix plays a very important role in maintaining a pregnancy till term. And a few of the many complications that can happen due to an incompetent cervix are miscarriage or preterm delivery. According to my research, an estimated 15 million infants are born prematurely every year. That is more than 1 in 10 births. Having an incompetent cervix puts women at high risk for preterm delivery, with 1 million infants dying each year due to complications. Premature infants are more likely to have health problems than those born on time, and usually spend at least a few weeks, if not months, in a neonatal intensive care unit. Health problems can include low birth weight, respiratory distress, jaundice, and anemia. There are many risk factors that can contribute to preterm labor. But for the sake of my research question, I've chosen to focus on the risk being an incompetent cervix. Cervical incompetence affects nearly 1 in every 5 pregnant women, and many don't become aware of this condition until they have lost their first pregnancy. Unfortunately, there is no diagnostic test for cervical insufficiency, and the diagnosis is usually a retrospective one based on a shortening cervical length, a history of recurrent second trimester loss, or early preterm delivery following painless cervical dilation in the absence of contractions and bleeding. There are a few treatment options that are used in dealing with an incompetent cervix. My goal was to find literature that compared strict or modified bed rest being expectant care as opposed to placing a cervical cerclage. I began my research process by searching through databases. I used a systemic and objective method to verify that the research I reviewed included consistency in data collection and was free from personal bias. I chose 3 different studies to gather my evidence. The purpose of all 3 research studies was to evaluate whether women with an incompetent cervix have better pregnancy outcomes when treated with a cervical cerclage compared to those receiving expectant care. The research studies contain a sample size that ranged from 68 to 253 pregnant women whom were diagnosed with an incompetent cervix. One of the studies was an observational study in which medical record charts were reviewed for management and outcome after delivery. The remaining studies were both randomized controlled trials in which expectant mothers with an incompetent cervix were treated with a cervical cerclage as opposed to expectant care. Pregnancy outcomes were then compared. The results of each of the studies was the same. The use of a cervical cerclage allowed for lower premature delivery rates with greater gestational age and a higher neonatal birth weight. The authors also concluded that routine sonographic measurement of cervical length from 16 to 24 weeks identifies a group at high risk of preterm delivery, as the risk of preterm delivery increases dramatically with a decrease in cervical length from less than 1% at 30 millimeters to 80% at 5 millimeters. The studies did have the limitation of a small sample size. However, the researchers provided and inclusion criteria when selecting the participants, such as cervical length or painless dilation. This assisted them in producing a more generalized study, therefore increasing strength of evidence. Through my research and personal experience, I found that many OBGYNs and perinatologists support the treatment option of placing a pregnant woman with an incompetent cervix on strict or modified bed rest, as opposed to placing a cervical cerclage, which was once a highly used treatment option. I believe this is due to the possible risks of placing a cervical cerclage. Reported adverse events after cerclage placement are rare, but may include abdominal pain, vaginal bleeding, premature rupture of membranes, and chorioamnionitis as a late complication. The placement of a cerclage might seem like more of an invasive treatment. However, I personally believe that it allows for an increase in patient safety and quality of care. Through my research, I found that expectant mothers who receive a cervical cerclage can return to work and their usual activities after a few days without any restrictions. There is also a decrease of hospitalizations in those who receive a cerclage compared to those on bed rest, therefore reducing the risk of hospital-acquired infections and, of course, those really expensive hospital bills. Given that the most current evidence points to a cervical cerclage being most effective in treating cervical incompetence and preventing preterm delivery, I believe that a change in obstetrics and gynecological treatment guidelines is warranted. It is important that I reach out to as many healthcare professionals that are involved in everyday patient care of those expectant mothers that could possibly suffer from an incompetent cervix. I plan to do this by communicating my research findings with nursing staff and physicians, and due to my pregnancy, I'm in constant communication with many OB and special care nursery personnel, as well as medical assistants, OBGYNs, and perinatologists in the clinics I attend. I will verify the effectiveness of the education I provide by monitoring data pertaining to cervical cerclage placement in our local hospitals, as well as pregnancy outcomes. Research has shown that the use of a cervical cerclage allows for lower premature delivery rates with greater gestational age and higher neonatal birth weights. Healthcare providers should consider the use of a cervical cerclage as a treatment option for an incompetent cervix. Patients should be informed of all treatment options, including the benefits and risks of each, and allowed to make educated decisions about their care. Thank you for your time. Have a good night.